Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about, are bipolar disorder and OCD really related? Bipolar disorder and obsessive compulsive disorder OCD are two distinct medical diseases. Experts think that the two, albeit unrelated, can occur together. The statistics given by the National Institute of Mental Health serve as proof of this. 1% of the 2.6% of American adults with bipolar disorder also exhibit OCD symptoms. Difference between OCD and bipolar. You must first comprehend the distinctions between obsessive compulsive disorder and bipolar disorder in order to understand how the two are related. 1. Bipolar disorder. Extreme mood and energy swings are symptoms of the mental condition known as bipolar. When compared to other normal people, these shifts are typically far more dramatic. Therefore, the dramatic changes are sufficient to make it difficult for the patient to carry out daily tasks. People who have bipolar disorder frequently go through extreme emotional upheaval, ranging from being extremely excited to being quite depressed and lazy. Unusual activities, sleep patterns, and other behaviors will follow these changes. 2. Obsessive compulsive disorder OCD. OCD is a psychological condition that produces recurrent, uncontrollable thoughts, obsessions, and urges to take certain acts. OCD sufferers frequently experience unwelcome thoughts and anxieties. In response to their dread, this subsequently breeds a desire to do something repeatedly. For instance, OCD sufferers may continually wash their hands until they are dry and painful out of a fear that germs would attach to them. Relationship between obsessive compulsive disorder and bipolar. According to a study, between 10 and 35% of individuals with bipolar disorder also experience OCD. Actually, the majority of them had OCD symptoms prior to developing bipolar disease. OCD is the most prevalent anxiety disorder in bipolar disorder patients, thus researchers think this makes sense. Additionally, according to some studies, those with bipolar disorder are up to 5 times more likely than those with depression to acquire obsessive compulsive disorder. People who have both bipolar disorder and OCD have a condition that is very concerning when taken as a whole. This is especially true of self-control and panic disorder. Some symptoms of OCD are shared by people with bipolar disorder. They frequently struggle with a number of ailments, including anxiety, social phobia, and mood swings. The key distinction that leaps out, though, is that persons with bipolar disorder don't repeatedly perform the same thing or experience intrusive thoughts like those with OCD. Treatment for those who simultaneously suffer from bipolar disorder and OCD. The symptoms of bipolar disorder are typically more challenging to manage when these two mental disorders coexist. The cause is that people who suffer from these two diseases abuse drugs and alcohol more frequently. Treatment becomes slower and more challenging as a result. According to experts, mood stabilization is the initial step in treatment for persons with obsessive compulsive and bipolar disorders. Typically, this is accomplished by combining medications such as lithium with anticonvulsants or atypical antipsychotics with aripiprazole or Abilify. Additionally, medical professionals will be far more cautious when combining medications for two illnesses that occur at the same time. The incorrect medicine combination can cause symptoms to manifest more frequently and with greater severity than usual. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.